If I'm audible to you all properly, just let me know. We'll start up with the today's session. Okay. So am I audible? Guys, am I audible and visible? Just say yes in the comments so that I can start with today's session. Am I audible and visible to you all? Perfect. So we'll be discussing some questions from the old past exams that has come. So I have just gathered all the questions, okay, and we'll be just going through all the questions. Whichever questions I'll feel like that we need to explain it further, I'll be explaining those questions. But because a lot of questions are questions that has come from past exams or are recalled questions, so you will not be wasting time discussing those old questions that you know. So the first and a very common question that's been asked many times recently also in the exams is this: that they ask you what are these, what's the name of this instrument. So you need to remember and identify these instruments. So these are basically explorers, okay, and this is the hash 17 and this is the hash 23 end of the explorer. Okay, so please remember hash 17 and hash 23. Okay, so the answer here would be number 1. The second question is this: they have given you this picture and asked what kind of defect is in the given image from right to left. So right now they are asking from right to left. So first they are asking about this. This is a fenestration and this is a dehiscence, because he's asking from right to left. So first I need to tell it about the right one. This is a fenestration. What is a fenestration? A fenestration is a defect in which the marginal bone is intact, and the dehiscence is a defect in which the marginal bone is not intact. Okay. So the first one is a fenestration, this is a dehiscence. So if you look upon the option, the first option looks anyhow to be correct. Okay, so answer here would be not 2, it would be 1. Okay, so answer here would be 1. So right to left. Next question is, which of the following antiseptic mouthwashes is most commonly indicated for the management of gingivitis due to its substantivity and broad spectrum antimicrobial activity? So the two key words in this question are substantivity and the antimicrobial, broad spectrum antimicrobial effect. So we all know very well that chlorhexidine has a substantivity effect for a long period of time and also a broad spectrum because it acts against all gram positive, gram negative bacteria and all fungi, viruses, everything. Now, what is substantivity? Substantivity for chlorhexidine. They may also ask you a question for how long this substantivity effect is there. So it is for 12 hours. So the question they can also ask for how long the substantive effect for chlorhexidine is. So it is for 12 hours. Okay. So answer here would be 3. So a lot of, see, these answers are not given by me. So a lot of this has been accumulated from various sources. So whatever answers I'm telling you, please follow those answers. Just don't blindly follow the answers that have been written here below that. Okay, so we are discussing each and every question. The answers that we are finalizing now would be the final answers, not that are being written here. Okay, the next question: which of the following procedures is specifically intended for the removal of tooth side of periodontal pocket? Okay, so now what is he asking in the question कि इनमें से कौन सा ऐसा प्रोसीजर है जिसमें कि टूथ साइड में से हम कुछ हटा रहे हैं, पॉकेट जो पूरी पॉकेट वॉल वाला जो सिस्टम है उसमें से if you are removing something from the tooth side, it means we are removing a tooth. So in which of the procedures we are removing a tooth? It is hemisection. Okay, so because in undisplaced flap or apically displaced flap or gingivectomy, in all these things, generally we remove from the pocket wall, maybe a pocket lining or a pocket wall. So those are not the answer here. The answer here would be for hemisection. Okay, so answer here would be hemisection. Next question, question number 5. A furcation defect in which the probe passes completely through the furcation, through and through. Okay, so through the furcation, it means it could be grade 3 or grade 4. Because through and through pass grade 3 or grade 4 में. The difference between grade 3 and grade 4 is grade 3 में clinically you cannot see the through the furcation through and through. But in grade 4 you can see clinically through and through. So now let's read the question further. But the furcation is not clinically visible due to soft tissue coverage. So it means it is grade 3 because in grade 3 the furcation is clinically covered with soft tissue and it's not clinically visible. So if it is clinically visible, it will become grade 4. So answer here would be grade 3. Next question. What is the expected result when prophylactic low-level laser therapy is applied on the oral cavity? See, this LLLT therapy is generally a therapy to enhance healing. A lot of time people have ulcers also, then also this therapy is given. Okay, and it helps to reduce the inflammation. Okay, so now let's read out the options. So what is the expected result when this LLLT therapy is applied? Formation of calculus, it has no role into it. Increase bleeding on probing, I am saying it reduces the inflammation. So on the contrary, it will reduce the bleeding on probing. Okay, root sensitivity, it has a role in desensitization. On the contrary, it helps in reducing the sensitivity. So it is also wrong. Though it has been seen that LLT therapy, when it is given, it leads to some melanin pigmentation. So answer here would be it reduces the melanin pigmentation because it reduces the inflammation. As the inflammation will reduce, the redness will reduce, so the depigmentation will happen. So answer here would be gingival depigmentation. Okay, do you get me? So LLT therapy basically is a therapy to reduce the inflammation. It means reduce the redness, swelling and pain. So if the redness is reducing, the pigmentation will be reduced. So the answer here would be 2, gingival depigmentation. Okay. Now the next question is, so the next question is, which of the following is the most abundant crystalline component of dental calculus? Now if you see dental calculus, uh, uh, the maximum amount is, the maximum inorganic amount is hydroxyapatite. Hydroxyapatite is around 58%. Magnesium white locite is around 21%. Octacalcium phosphate is around 12%. And brucite is just 9%. So out of this, the best answer here would be hydroxyapatite. So answer here would be hydroxyapatite. Okay. Okay, the next question. Osseointegration of dental implant occurs through which of the following structures at the soft tissue interface? So ये क्या पूछ रहा है क्वेश्चन में? ये पूछ रहा है इम्प्लांट बोन से ऑस्टियो इंटीग्रेट हो गया, इम्प्लांट के ऊपर जो सॉफ्ट टिश्यू होता है, जिंजाइवा होता है, वो जिंजाइवल कनेक्शन विद द इम्प्लांट is through which attachments? Okay, so basically there are two main attachments. One is hemidesmosomes and the second is basal lamina that helps in the integration of the soft tissue with the implant. So please remember, implant का bone से integration में ये help नहीं कर रहा. Implant to bone is osseo integration, but above the bone, over the implant, there is a soft tissue. That soft tissue also attaches, or there is an interface between that soft tissue and that bone and implant. That interface is connected through two structures, that is basal lamina and hemidesmosomes. Okay, so please remember the answer here would be basal lamina and hemidesmosomes. Okay. Okay, now next question is a single nucleotide polymorphism in interleukin 1 alpha and interleukin 1 beta genes is associated with genetic predisposition to periodontal disease. Which of the following terms best describe this genetic trait? Acha, before attempting this is very important. This topic has been asked so many times in the question. First, let's understand what is risk factors, risk determinants. क्या क्या होते हैं? So first is risk indicator. रिस्क इंडिकेटर क्या होता है? इट इज बेसिकली प्रोबेबल रिस्क फैक्टर्स जो कि क्रॉस सेक्शनल स्टडीज से आइडेंटिफाई हुए बट दे आर नॉट कंफर्म्ड विद लॉन्गिट्यूडनल स्टडीज. प्लीज रिमेंबर दीज डेफिनेशंस एंड द एग्जांपल्स. हर बार एग्जाम में देयर इज वन क्वेश्चन दैट इज बीन आस्क्ड फ्रॉम दिस, सो प्लीज रिमेंबर इट इज वेरी इंपॉर्टेंट. So risk indicators are risk factors that are identified in cross-sectional studies but not confirmed through longitudinal studies. Okay, risk predictors or markers, they are those which are associated with increased risk of disease but they do not cause the disease. मतलब ये जब रिस्क प्रिडिक्टर्स होंगे तब वहां पे डिजीज होने की प्रोबेबिलिटी इंक्रीज हो जाएगी. लाइक ब्लीडिंग ऑन प्रोबिंग, जैसे प्रीवियस हिस्ट्री ऑफ पेरिडोंटल डिजीज. Okay, they increases the probability of having the disease but they do not cause the disease. These are risk markers. Okay, the third very important is risk determinants, also known as background characteristics. ये वो रिस्क फैक्टर्स होते हैं जिनको आप मॉडिफाई नहीं कर सकते, चेंज नहीं कर सकते. जैसे लोगों के जेनेटिक फैक्टर्स, लोगों की एज, जेंडर, उनका स्ट्रेस, सोशियो इकोनॉमिक स्टेटस, ये सब के एग्जांपल्स क्या हो गए? रिस्क डिटर्मिनेंट्स जिनको आप मॉडिफाई नहीं कर सकते. ओके, एंड द लास्ट इज रिलेटिव रिस्क. रिलेटिव रिस्क इज द रेशियो ऑफ द रिस्क ऑफ द डिजीज इन द पीपल एज कंपेयर टू द अनएक्सपोज्ड ग्रुप. सो मतलब कितना टोटल आउट ऑफ ऑल द टोटल पीपल कितने लोगों में रिस्क है ड्यू टू दैट रिस्क फैक्टर दैट द डिजीज विल हैपन. So anyhow, let's see the examples. Risk factor के examples tobacco, diabetes, bacteria, calculus, plaque, ये सब किसके examples हो गए? risk factor के. Risk determinant वो थे जो उनको modify नहीं कर सकते, जैसे genetic factors, age, gender, stress, socio-economic status. Risk indicators वो थे जो कि cross sectional study से identify हुए थे, longitudinal से नहीं हुए थे. 3, please remember the examples: HIV, osteoporosis and infrequent dental visits. And last, risk markers. So right now जो अभी हमारे पास क्वेश्चन है, इसमें इसने क्वेश्चन जो दिया, इट्स अ जेनेटिक ट्रेट. जेनेटिक ट्रेट कैन नॉट बी मॉडिफाइड, सो द आंसर हियर वुड बी रिस्क डिटर्मिनेंट. सो द आंसर हियर वुड बी रिस्क डिटर्मिनेंट. इसने बहुत कॉम्प्लिकेट करके क्वेश्चन दिया हुआ है, बट द मेन थिंग दैट वी हैव टू सी इज दिस इज अ जेनेटिक ट्रेट. Okay, so the answer here would be risk. It's not risk factor. Please remember, it is risk determinant. Next question is, which of the following type of joints connects a tooth to its socket via PDL? Anyhow, it's an anatomy question, but still, the joint that helps to attach the tooth to the socket with PDL is known as gomphosis. It is known as gomphosis. Okay, next question. During which stage of gingivitis does the greatest amount of collagen breakdown occurs? Okay, can you tell me the answer for this? There are 4 stages of gingivitis. We all know this: stage 1, stage 2, stage 3, stage 4. So out of all the 4 stages, which has the maximum amount of collagen breakdown? Which stage? Can you tell me the answer for this? Anyone? Okay. So अब क्वेश्चन देख के तो हमें लग रहा है स्टेज 4 सबसे ज्यादा डेंजरस होती है बिकॉज उसमें सबसे ज्यादा बोन लॉस होता है. Stage 4 would be the answer. Please remember, stage 4 would not be the answer. The answer here would be stage 1, because this is the stage when the collagenase enzyme is active and it will lead to breakdown of the collagen. Stage 4 में डिस्ट्रक्शन सबसे ज्यादा होता है, बट वो ऑस्टियोक्लास्ट के कारण होता है. बट कोलाजन ब्रेकडाउन सबसे ज्यादा कोलाजिनेज एंजाइम की वजह से होता है, वो स्टेज 1 में होता है. प्लीज रिमेंबर दिस. ओके, सो द आंसर हियर वुड बी स्टेज 1, not stage 4. Though stage 4 is more advanced stage of gum disease, but इनमें bone loss is due to osteoclast, not due to increased collagen breakdown. Collagen breakdown is in stage 1 of gingivitis. Very important. कई जगह आंसर गलत दिया हुआ है इसका, प्लीज रिमेंबर दिस. ओके, नेक्स्ट क्वेश्चन. Male patient presents with gingival recession measuring less than 3 mm, accompanied by less than 10% bleeding on probing. There is no evidence of alveolar bone loss. No evidence of alveolar bone loss. Please remember this. कोई bone loss नहीं है. Based on these clinical findings, what is the most likely diagnosis? Bone loss नहीं है मतलब periodontitis तो नहीं है. It is in the soft tissue. So it means it is gingivitis. So out of all the 4 options, we have only one option, that is gingivitis. So it means the answer here will be generalized gingivitis, not periodontitis. Okay. So the answer here would be 1, generalized gingivitis, because he has given the thing that there is no evidence of alveolar bone loss. Okay. Next question. With reference to the systemic inflammatory response in periodontitis, a patient is diagnosed with grade C periodontitis is considered to have good prognosis if the C-reactive protein level is. So you know, C-reactive protein is a marker that is also used for cardiovascular diseases. So it has been seen a lot of factors that are seen in cardiovascular diseases and periodontitis are same. So now he's asking a question that this C-reactive protein, iska level किस लेवल तक है that it would be considered that this patient of periodontitis has a good prognosis. So please remember, when the value of this C-reactive protein is less than 1 milligram per deciliter, then it is considered good. Above 1, between 1 to 3 is considered moderate. Less than 1 is considered low and it is good prognosis. So the answer here would be less than 1 milligram per DL. Okay, that is considered as low and as considered as patients good prognosis in patients with periodontal diseases. Okay. Next question, very important, very important, and people, the examiners are asking question on these classifications. I'll be discussing this classification now. So the question is, a 45-year-old patient presents with mandibular molar exhibiting gingival recession and furcation involvement. Clinical examination reveals a clinical attachment loss of 5 mm. First important point. Radiographic findings confirm bone loss extending to the middle third of the root. Okay. Patient is non-smoker and non-diabetic, no history of diabetes. So first, let's understand the classification. See, there are four stages of class. Please remember this. If you have want to take a picture of this, please take a picture of this. Otherwise, I'll post it in the group also. So there are four stages of periodontitis staging. Okay. The first stage, the clinical attachment loss is 1 to 2 mm. Stage 2, 3 to 4 mm. Stage 3, greater than 5. 4 is also greater than 5. Okay. So right now, we in the question we have asked a clinical attachment loss of around 5 mm. So our answer could be stage 3 or 4. Now, severity of bone loss. So it extends to coronal third, but more of coronal third, 15 to 33%. It extends to middle third of the root and beyond. It extends to middle third of the root and beyond. So in this also both middle third. So abhi bhi in the question it's mentioned, if you see the question, that the bone loss has extended to the middle third of the root. So right now our options could be both 3 and 4. Okay. So the question here does not completely tell us that is it 3 or 4. So either there is some information that is missing here, because it's not specifically mentioned that we can differentiate out of this classification that it is 3. So there should be some more information. Could be there must be some information more. Maybe the question is missing that we when the question is recalled. हो सकता है they have mentioned number of teeth involved are less than 4 or maybe more than 5. So it will differentiate it. In other options, it could be more probing depth, vertical bone loss. Okay. So in any addition complexity, if there is there, so I think they should have mentioned this also in the question that the number of teeth involved is less than 4 or more than 5. So anyhow, if it is grade 3 or grade stage 3 or stage 4, it will depend upon these three values that we have to decide. Now there is one more thing, that is grade 1, grade B. So grade A is when the patient is a non-smoker and no history of diabetes. Okay. So there is a grading system at which it is graded into 1 A, B, C. A is slow progression, B is moderate progression, C is rapid. In A progression, the patient is non-smoker and no diabetes without systemic condition. B is there is mild smoker and mild diabetes, and C is when the patient is heavy smoker, 10 cigarettes or more, and uncontrolled diabetes. So right now our question says the patient is non-smoker and no history. So it is grade A. So my answer could be stage 3 grade A or stage 4 grade A. So out of these four, I have to select one. Two, I have to select one. Generally, it is done whenever a staging is done. We always, if there is no conclusive answer, we always select the lesser stage. So I am selecting answer 1 as better. But if you get one more thing in the question like number of teeth involved, we'll get a conclusive answer. So out of these options, I would select answer 1 as the best option here. Okay, did you get this? This is very important. So please remember this classification. They're asking a lot of questions out of this classification. Okay. So this classification is given, and if you can want to see it on online also, it's perio.org 2017 WWDC. Okay. And see this grading system also. Otherwise, I'll put it in the group. Next question. Idiopathic gingival enlargement is best described as. So, idiopathic gingival enlargement is also known as gingival fibromatosis, and it is basically known as it is familial in origin. Familial in origin means it is hereditary in origin. So answer here would be 2. Okay. Just a second, please. Excuse me. Okay. Next question. Next question is, a patient presents with less than 2 mm of clinical attachment loss over the past 5 years but reports smoking more than 10 cigarettes per day. Based on this information, what is the grade? So right now we have to just do the grading, not the staging. So grading is number of cigarettes is more than 10. Matlab he is a heavy smoker. So right now just I told you that it is grade 3. In grade 3 there is people that are heavy smokers and uncontrolled diabetes. So the answer here would be grades 3, that is C. So the answer here would be 3. Okay. Okay. Next question. Stage 3 and stage 4 lesions are characteristic of which of the following conditions? So right now he is asking about Honing and Cohen's classification. If you remember Honing's and Cohen's classification, there are 7 stages. In stage 1 there was necrosis of the tip of interdental papilla. In stage 2 there was necrosis of entire interdental papilla. Stage 3 necrosis of marginal gingiva. 4 attached gingiva. 5 necrosis extending to buccal and labial mucosa. 6 necrosis exposing alveolar bone. And 7 necrosis of cheek and skin. Now, out of these 7 stages, 1 is considered as NUG, 2 is considered as either NUG or NUP, 3 and 4 are considered as NUP, 3 and 4 are considered as NUP, 5 and 6 are considered as necrotizing ulcerative stomatitis, and 7 as NOMA. So, right now he has asked about 3 and 4. So, 3 and 4 is considered as NUP. So, the answer here would be 2. Here answer would not be 3, answer here would be 2. So please remember the answer here would be 2, that is NUP. This is not 3 here. Okay. So the answer here would be necrotizing ulcerative periodontitis. Okay. Next question. Which of the following is classified as surgical curate? Barnhart's is not a surgical curate. Gracie is not a surgical curate. Kirkland and Orban's are surgical curate. So the answer here would be Kirkland's knife. Kirkland's knife is a surgical curate. Okay. Which of the following correctly describes the dimensions of periochip and composition? So periochip is basically chlorhexidine and the size is 4 into 5 into 0.35 mm. 4 into 5 into 0.35 mm. So the answer here would be 3. Already done this question. Which drug is commonly used to reduce bone loss in periodontitis? Okay, so now we know periodontitis, the bone loss is reduced by reducing by NSAIDs, because NSAID specifically inhibits the prostaglandins. So the answer here would be ibuprofen, that is 4, option 4. Okay. Okay, next question. If there is a recession of 2 mm, okay, and a pocket depth of 4 mm, what is the clinical attachment level? So right now what he is asking is, what is the clinical attachment level? It means he is asking about the clinical attachment loss. So 2 mm ka recession plus 7 mm pocket. So it means if you see total from cement to enamel junction, it will be 2 plus 7 equals to 9. So it will be 9 mm of total clinical attachment loss. Okay. Okay, next question. Which of the following steps of osseous surgery is in the correct order? Okay, so they are asking about the steps. So whenever an osseous surgery is done, the first step is to create grooves. That is vertical grooving. Now once these grooves are being done, now what is done? You blend these grooves. So then there is radicular bending. So next option would be radicular bending. Now, once this radicular bending is done, then what is done? The next option would be flattening of the interproximal bone. The interproximal bone is flattened, and at the end, the marginal bone is corrected. The gradualization of the, so whatever window peaks are there, that is corrected in the step 4 by gradualizing the marginal bone. So the answer would be number 1, 4, 3, 2. 1, 4, 3, 2. 1, 4, 3, 2. So the answer here would be 2. Okay. Next question. Maximum pigmentation is seen in. Okay. So the option are gingiva, hard palate, mucous membrane, tongue. So out of these options, if you see, maximum pigmentation is seen in hard palate and gingiva. In both, maximum pigmentation is seen. But if you have to choose one single best answer, hard palate has more pigmentation and would be a better answer here. Okay. Next question. Which of the following statements is true about Langerhans cell? They contain modified lysosomes in the suprabasal layer. Okay. They do not possess G-specific granules. It is wrong. They are dendritic cells present in all the layer of epithelium. Wrong. They are involved in ATPase activity. This is partially correct. Okay. They are, so out of these options, I would say option A is completely correct. That is, they are modified lysosomes, okay, that are present in suprabasal layers. Okay. So this is option A is correct here. So this question we have already done. Next question. Okay. The resorption of thickened bony plates resulting in a plateau-like bone margin. So plateau-like bone margins is ledges. It is ledges. So the answer here would be ledges. Osseous craters kya hote hain? They are basically it's like a elevation of the buccal and the palatal wall, and it's a two-wall defect. Okay. Buttressing bone formation is when more forces are being applied, like in TFO, the bone forms on one side and resorbs on the other side. This leads to buttressing bone formation. It is of two types. One is peripheral and the second is central buttressing bone formation. In a peripheral buttressing bone formation, also known as lipping, and in central buttressing bone formation, the bone forms in the center as resorbs in the peripheries. Okay. Reversed architecture. What is a reversed architecture? See, bone architecture are of three types: positive, negative, and flat. A positive architecture is when the interdental bone peak is higher and the interradicular bone peak is lower. That is positive bone architecture. If the interdental bone peaks become lower and the interradicular bone peaks become higher, that is reverse bone architecture. And flat is when both interdental and interradicular bone becomes at the same level. Okay, so the answer here would be ledges. Okay, next question. In case of ossification occurring in the membrane, from which type of cells do osteoblasts originate? So please remember, all these cells, osteoblast, fibroblast, all these cells, they originate from undifferentiated mesenchymal cells. From undifferentiated mesenchymal cells. Okay, so the answer here would be 1, undifferentiated mesenchymal cells. Next question is, which of the following is true for Anak? Number 1, viral cause, wrong. Blistering of the gingiva, wrong. There is necrosis of the gingiva. Interdental bone loss is not correct. Punched out appearance of interdental papilla is correct. So the answer here would be D. Number 4, simple straightforward question, very simple. Next question, which of the following is the clinical indicator of TFO, trauma from occlusion? So right now the point here is that you need to understand is clinical indicator. All these are indicators what he has given in the question, but right now is asking for clinical indicator. So increased tooth mobility, yes, because clinically, how do you see that this is due to TFO? you will see that there is tooth mobility that is increased. PDL widening, angular bone loss, all these are not clinical indicators. Okay, so the answer here would be increased tooth mobility. Okay, next question. The internal bevel incision marked as number 2 in the given image is in the following. What is this? So he's asking about this number 2. So let's see all the markings. Number 1 is for internal, it's an internal bevel incision that is given for modified Whitman flap. Okay, and even 1 and 3 both are same. They can be given for modified Whitman flap and apically displaced flap. Number 2 is for undisplaced flap. Okay, this is for undisplaced flap. So the answer here would be undisplaced flap. So if he asks for 1 or 3, it is for apically displaced and modified Whitman flap. Okay, in patient who smokes, which of the following is observed? So please remember, in the patient who smokes, the first option is increased level of GCF and increased subgingival temperature. This is partially correct because in smokers there is transient increase in GCF. मतलब initially थोड़ा सा increase होता है. So this option is partially correct. I'll see if I have a better option. Otherwise, I'll mark this. The second option is increased level of tumor necrosis factor alpha and prostaglandin E2 in GCF. So this is correct because these are inflammatory factors. These are cytokines that are increased in GCF in patients who smoke. So this is correct. Third, increase in yellow colonies, not necessary. Fourth, decrease cytokines. No, they increase. So this is wrong. So out of option 1 and 2, both 1 and 2 are correct. 1 is partially correct. 2 would be a better answer here. Okay. So in smokers, there is transient increase in GCF flow. Next question. Which of the following materials is not used for root conditioning along with MT? Which of the following materials is not used for root conditioning along with MTA? Okay. So now, first of all, what is root conditioning or root biomodification? So root conditioning is a procedure that is done before a lot of mucogingival surgeries, by which, first of all, it helps in attachment of the Sharpie's fiber again into the tooth. So reattachment में help करते हैं, new attachments में help करते हैं, sorry. And secondly, if there are say any endotoxins and bacteria, any necrosed portion on the tooth surface, that is removed. Okay. Citric acid is commonly used, 25% EDTA is commonly used, tetracycline is used, doxycycline is not used. So the answer here would be doxycycline. Okay. Next question. Which of the following is not a universal curate? So universal curates are curates that can be used in every area of the mouth. So we all know, out of all these curates, Gracie curates are not universal curates. Those are curates that are used for specific areas on the tooth. Like Gracie 1112 is used on the mesial surface of the posterior teeth. So the answer here would not be 4 because this is not a universal curate. Okay. Next question. When a patient with an advanced periodontal disease reports to the clinic, which factors should be considered in treatment planning? Number 1, ability to come, secondary occlusal trauma. Okay, so these options are not correctly recalled. I think I'll just correct them. Ability to correct secondary occlusal trauma. What is secondary occlusal trauma? So there are two types of TFOs. One is primary, in which the tooth is strong enough but the forces are more. The secondary is when the tooth is periodontally compromised, even the normal forces are beyond the adaptive capacity of the tooth. So pehli cheez ki when the patient with advanced periodontal defects reports to the clinic, so he is asking ki kin factors ko hame treatment planning mein consider karna. Obviously we need to correct the secondary occlusal trauma. That is very important. Number 2, patient willingness to save the teeth. That is the most important thing. If the patient is not willing to save the teeth, none of the treatments would work. So this is also correct. Third, amenability of mean morphology to regeneration. Okay. Now, what does this option mean? इस option का मतलब है, suppose there is a defect. That defect is like a bowl. अब अगर उसमें कोई भी मैं ग्राफ डालूंगा या रीजनरेट करूंगा तो उसका रीजनरेशन पोटेंशियल ज्यादा होगा. एंड सपोज दिस इज फ्लैट, दिस डिफेक्ट, एंड इफ आई पुट एनी ग्राफ्ट हियर, वो यहाँ पे स्टेबल नहीं होगा. So the morphology of the defect, there the regeneration needs to be done. It needs to be considered in your treatment planning. So this is also a very important factor. Very correct. This is also correct. Fourth option, the potential for prognosis improvement with treatment. अब whenever you plan a treatment plan, आप उस ट्रीटमेंट प्लान में देखते हो कि इसका प्रोग्नोसिस क्या है, डिपेंडिंग अपॉन द सीवियरिटी ऑफ द डिजीज. ओके, सो विल सी that what is the prognosis, that will also be a part of our treatment planning. So according to me, all the options here are correct, A, B, C, D. Okay, so it's all options are correct here. Okay, next question. Which inflammatory markers are more likely to increase in individuals with periodontal disease compared to those with cardiovascular disease but without periodontal disease? पहले क्वेश्चन को समझो. What he is asking is कि ऐसे कौन से मार्कर हैं सिर्फ उन पेशेंट्स में जिसमें पेरिडोंटल डिजीज होती है उनमें बढ़ते हैं, एंड एज कंपेयर टू इन पेशेंट्स जिसमें सिर्फ कार्डियोवास्कुलर डिजीज है बट पेरिडोंटल डिजीज नहीं. सो व्हाट इज आस्किंग, व्हाट आर द कॉमन मार्कर्स, inflammatory markers that rises in both patients with periodontal disease and cardiovascular diseases? So please remember these markers, very very important. They are common in both these patients, that are fibrinogen, C-reactive protein, interleukin 1, interleukin 6, tumor necrosis factor alpha. All these factor increases in patients with cardiovascular disease and in patients with periodontal disease. So the answer here would be 3. Okay. Okay, this will do. So necrotizing ulcerative periodontitis is not characterized by recession, maybe bone loss hota hai, tooth loss bhi ho sakta hai, pocket, no, because there is necrosis of gingiva. So there is no pocket formation for sure. So the answer here would be 4. Next question. Streptococcus mutans are able to attach to the tooth surface. Very old question. 100 of times it's been asked. It is due to oligopolysaccharides, extracellular polysaccharides, dextrans, one and the same thing. तो कुछ भी ऑप्शन में मिल जाए, oligopolysaccharides, extracellular polysaccharides, dextran, it is one and the same thing. The answer here would be 3. Option 3. Highest number of bacteria can be found in interproximal surface. Again, a very old question. So I'm not going to discuss all these questions deeply. So these are simple old questions that have been asked many times. Now next question. Okay, very important, very good question. Marginal bone loss. What do you mean by marginal bone loss? At the implant crest. After implant placement occurs due to all except. Okay. Length of the implant, diameter of the implant, abutment surface and osteotomy. अब आपने एक implant डाला है ना, now they are asking that marginal bone loss can occur due to all of the reasons except. See, if the length and diameter of that implant is less, when the patient bites with that implant crown, the forces can lead to bone loss. So these are ruled out. Abutment surface. So if the abutment and implant connection is not proper, that also leads to some movement where that abutment and implant are meeting near the bone. That can also lead to bone loss. Osteotomy ka marginal bone loss pe koi osteotomy is that hole we create in the bone to put that implant. Once that hole is created, once that implant is placed, it cannot lead to marginal bone loss due to osteotomy. So the answer here would be 4, osteotomy. Okay. Next question. Gingival manifestations are more common in which of the leukemic disease? We know AML में enlargement मिलता है, especially M4, M5. Sorry. Very common in AML, acute myelocytic leukemia. That is M4 and M5 type. Junction between basal lamina and epithelial cell is हेमीडेस्मोसोम्स, सिंपल क्वेश्चन. दोनों को अटैच करने के लिए कौन सा अटैचमेंट होता है? हेमीडेस्मोसोम्स. ओके. Major inorganic component of supragingival calculus is calcium phosphate. सबसे ज्यादा कंटेंट किसका होता है? कैल्शियम फॉस्फेट इन supragingival calculus. True about TFO is all except number 1, change in alveolar crest levels, maybe because of crestal bone loss. Does not cause pockets and gingivitis. Very correct. Please remember, in TFO there is no pockets and gingivitis. Number 3, marginal gingiva is affected. Wrong, because the blood supply of marginal gingiva is good. Marginal gingiva is never affected. This is wrong. So answer here would be 3. Fourth option is tooth mobility. So obviously tooth mobility is increased in TFO. So the answer here would be 3. Marginal gingiva is affected. What is this? This is neighbor's probe. Has markings at 3, 6, 9 and 12 for furcation. Used to see the furcations. Okay. Which calculus is found in mandibular anterior subgingival? Bruchite. सबसे ज्यादा कॉमन है mandibular anterior में in subgingival areas, that is bruchite. Okay. Motion of piezoelectric ultrasonic scalars. So piezoelectric. So please remember this trick. MEA plot. MEAPLT. So right now MEA, M for magnetostrictive, E for elliptical movement, A for all sides move. ठीक है? PLT. P for piezoelectric, L for linear movement and two sides. T for two sides. So MEA plot. So right now piezoelectric में linear movement. So the answer here would be C. Third, that is linear movement. So remember this small trick, MEA plot. Okay, next, dental plaque adheres to the tooth. Again, repeated question, dextran. We have already discussed this. Next question, group of PDL fibers which withstand masticatory forces are. Maximum masticatory forces are withstanded by the oblique fibers. Okay. So here answer would be 2 oblique fibers. The frequency of electrosurgery is. So again, very old question, simple, 1.5 to 7.5 megahertz. Remember it, nothing to explain. 1.5 to 7.5 megahertz. Next question, earliest sign of TFO. सबसे earliest sign क्या होगा? Mobility. Tooth थोड़ा थोड़ा मोबाइल हो जाएगा. That is the earliest sign of TFO. Not a secondary colonizer. So we have four options. So हमें ढूंढना है इसमें से primary colonizer. Speak gingivalis is a secondary colonizer. Fusobacterium nucleatum is a secondary colonizer. Teneralia forsythia is a new secondary colonizer. Streptococcus sanguis. Streptococcus full family is primary colonizer except Streptococcus constellatus. That is a secondary colonizer. Except Streptococcus constellatus, all type of Streptococci family is primary colonizers. So answer here would be Streptococcus sanguis. Please remember this chart. Okay, all Streptococcus, all actinomyces. AA comitans serotype A is a primary colonizer. Capno, जितने हमारे इनिशियल ग्रीन कॉलोनी के मेंबर्स हैं, है ना, दैट इज एस. ए फॉर ए कॉमिटेंस, ठीक है. सी फॉर कैप्नोसाइटोफेगा, है ना, and E for Echinella corrodens. All these are green colony members. So these are also primary colonizers. Okay? And also Velionella parvula. So these are all primary colonizers. Besides these, all are secondary colonizers. Okay? So आपको नाम क्या क्या रखने? A comitans, serotype A. Serotype B is a secondary colonizer. Please remember. Streptococcus सारे except Streptococcus constellatus. Actinomyces सारे primary colonizers है. Echinella corrodens, Capnocytophaga and Velionella. These are all primary colonizers. Okay. Okay, next question. There is an association. There are two statements. So they're asking about which one is correct. There is an association between gingivitis and adverse pregnancy outcomes like low birth weight babies, preterm babies. However, there is no clear evidence about this correlation. So this is a correct statement कि association तो है but exact क्या association है इसका correlation अभी पता नहीं है. So this is correct statement. Statement B, establishing clear evidence about the correlation between gingivitis and adverse pregnancy outcome would help treat the disease. This is also correct. So both A and B are correct. Both are true. So answer here would be 2. Okay. Next, a Papillon-Lefevre syndrome. Pick up the correct statement. So we all know in Papillon-Lefevre syndrome there is aggressive periodontitis that is seen. There is premature exfoliation. There is premature exfoliation of both primary and permanent teeth. There is calcification of dura mater, and there is palmar plantar keratosis. ठीक है? Only primary teeth का नहीं होता, primary और permanent teeth दोनों का होता है. So the answer here would be BCD. BCD. That is option 4. In next question is NUG. The membrane that is formed is pseudomembrane. Simple question. Okay. Next question is acute gingivitis due to local irritating factors found in all of these conditions except acute gingivitis. So in leukemia also gingivitis is seen. Vitamin C deficiency gingivitis is seen. In atherosclerosis has no relation. Diabetes also gingivitis, gingival inflammation is seen. So the answer here would be 3, atherosclerosis. Next question. All of these are plaque disclosing agents except. Okay, now what are plaque disclosing agents? So please remember this table. So plaque disclosing agents are iodine preparations. There are mercurochrome preparations, Bismarck brown, merbromin, erythrocene, fast green, fluorescein, two-tone solution, basic phosgene, and three-tone gel. All these are disclosing agents. Okay, now let's see the options. Erythrocene is there, two-tone dye is there, mercurochrome is there. Cetylpyridium chloride is an antiseptic agent. It's not a plaque disclosing agent. So the answer here would be 2. Okay. And next question. Microbes involved in familial transmission are all except. Very, very important question. This question has been asked from Carenza. I've read about 2-3 articles for that, and I found out this answer is the best option here. That AA comitans obviously has a familial transmission we have seen. Same is with Porphyromonas gingivalis and also for Fusobacterium nucleatum. But Teneralia forsythia, there is no literature which says that it is involved in familial transmission of a disease. So the best answer here would be familial Teneralia forsythia. Okay, Teneralia forsythia. And last question, initial therapy for ANAG. Which of the following statement is true? So for ANAG, for the first statement is to remove that pseudomembrane with a hydrogen peroxide. So we do a very gentle debridement so that the raw surface it heals with time. So a gentle debridement is needed at necrosis and unusual. This is wrong because necrosis is there. Needs to gentle debride because vascularity is good. Aggressive debridement wrong. It's gentle debridement because raw surface takes long time to heal. The answer here would be 4. That is gentle debridement because the raw surfaces takes long time to heal. Okay. So these are some old questions that I have discussed. If you have any queries, anything that we want to discuss, you can tag me in the group. I'll answer that. And if you want me to put all this in the group, I'll put this in the group also. After all the corrections that are there in the answers that are not marked 100% correct in this PDF. Okay. Thank you so much. Have a very good night and We'll meet very soon for the class next month mostly. Okay. Good night. Bye.